knee procedure, be it simple arthroscopy or a reconstruction, there is a range of exercises and movement programs that we would like you to do. We'd also like you to combine these, which need to be done regularly, with the use of an ice sleeve. We will make sure that you get one of these ice sleeves either at the surgery or before, and we'll talk about how to use that in a second. Let me introduce Julian Russell-Jones, who's a physiotherapist, and Nikki, who is our willing participant. Now Julian, there are basically 4 different exercises we would like to cover here, aren't there?
Yes.
Let's just go through what they are and then we'll talk about each one individually.
Okay, the first one is a calf pump, which is range of motion at the ankle and stretching through the calf muscle. The second one is an exercise called a co-contraction, which involves the muscles of the thigh at the back and the front. The third one is achieving full extension or straightening of the knee. And the fourth one is achieving the opposite range of motion, which is bending or flexion at the knee joint.
Okay, so let's go through this one by one. The first one was the calf pump exercise. Now the reason we do this is to encourage blood flow in the calf. And after you've had a knee operation, blood does tend to pool in the calf, and we want it pumped out to reduce the risk of clots. It also feels more comfortable when you're moving, doesn't it?
Absolutely.
So let's just show people how we might do that.
Okay, so the calf pump, foot all the way up, and all the way down, all the way up, and all the way down. Okay.
How often would we do this, do you think?
I think it's essential that every hour whilst you're awake, this exercise is being done.
And we do what, 20 repetitions?
10 to 20 repetitions.
Yes,
yeah.
Okay. The second exercise is designed to strengthen the muscles around the knee.
That's right.
And we call that the co-contraction exercise. So let's just talk about how we might ask Nikki to do that for us.
Okay, Nikki, what I'm going to get you to do is an exercise called a co-contraction exercise. It involves tightening up the hamstrings at the back of the thigh and then tightening up the quadriceps at the front of the thigh. If I can get you just to pull your heel down into the bed, that will tighten up the muscles at the back of the thigh, the hamstrings. Now, whilst you hold that, can you tighten up the muscles on the top of the thigh at the same time? And that's it. And Nikki's achieving that excellently.
And how long will we hold each of those exercises?
If you can maintain that co-contraction for 5 seconds, and you might do 5 exercises at a time.
And you might do that at least once an hour?
At least once an hour.
Okay, so let's just go through that again, because I think this is the thing that people find most difficult. The first thing is we ask people to push their heel into the bed, and that engages the hamstring muscle groups at the back of the knee. And then once we're firmly contracting those, we bring on the quadriceps muscles. And the idea is that they're both contracting together.
Both at the same time.
Hold for about 5 seconds, at least 12 to 15 times per hour.
Yeah, if you can do 5 lots of 5 seconds and do that a few times at a time, yes. And that'll make you maybe 10 to 15 sets each hour.
Well, that brings us on to the range of motion exercises. And the first of those is the knee extension exercise. Knee extension is when the knee is straight. And we achieve this at the time of surgery, and we're keen for you to make sure that it can happen. It's fair to say that people feel more comfortable with their knees bent after surgery. Yes,
often there'll be a towel roll or a pillow underneath the knee, and that will prevent the knee from going straight, and the longer it stays like that, the less likely it is for it to achieve full extension or straightening with comfort. And the easiest way is to remove anything that's under the knee and just allow the knee to lie flat for a period of time.
And achieving this early after the surgery makes it much easier to achieve in a reasonable time frame. If you leave your knee bent and you're trying to achieve that straightening out after a week or 10 days, it's much more difficult, isn't it?
It is much more difficult, and that has implications for your ability to walk, because we need to straighten our knee to walk.
That's correct.
And to achieve a normal gait, if you haven't had your knee straightening for a long period of time, then you tend to walk with a bent knee, and then that just upsets the knee.
And walking with a bent knee is a very tiring process, because normally when you wait there and your knee's straight, there's no energy involved, is there?
No.
When you have a knee that's bent, it is very tiring to walk any longer distances. So let's talk about the third exercise. Just before we finish that, we'll just talk about the use of something under the foot. Remember we were talking about that?
Yes, we had a towel roll.
So to assist the straightening process, yes.
This is probably the most convenient thing, is a towel roll. And if you just place it underneath the ankle, then that will allow the knee to go fully straight.
Okay, and then the fourth thing is to achieve bending of the knee.
And to achieve bending or flexion, The easiest way is to slide the knee up or down by drawing the heel up the bed and then letting it slide back down. Now if that's difficult, and in the early stages it will be, you can assist using your hands, as Nikki is just there.
And realistically, we're looking for about 90 degrees or a right angle of knee movement by a week. It does vary between different procedures, and after a straightforward knee arthroscopy, we would expect you to be able to bend to 90 degrees probably the same day. But after a reconstruction, that might take a week. As long as we achieve a right angle by about a week, we're pretty happy.
Yeah.
Now the last thing to cover is the use of ice.
Yeah.
And you would agree with me, wouldn't you, that ice is a very useful thing after surgery?
Ice is very useful as both as an analgesic and controlling the swelling.
We talked in the earlier part of this segment about the use of an ice sleeve. We will make sure that you have one of these. You may have one of your own to start with. But the structure of these is such that they have a refreezable central portion which comes out of the sleeve and which goes in the freezer. It might take an hour to freeze it the first time, but after that usually it's a little quicker. Once it's frozen, it goes back inside the bag. And it's then sealed. And then we wrap the ice sleeve around the knee, either from the back or the front, and we tend to do it back one time and front the next. And then there are little straps which have Velcro on them, which go right around. And the idea of doing this is that it brings the ice firmly into contact with the joint, which allows the joint to be really thoroughly cold. Once again, on the back one time, and then we'll turn it around and put it on the front the next. I think we should ice at least once an hour, don't you?
I think so.
Yes, I think so. And it's tremendously useful, and for about 10 to 15 minutes each time.
Exactly.
And we find that people's pain requirements are dramatically lower with the use of ice.